Hi, I'm Dr. Shiraz. I'm a senior consultant and head of multi-organ transplant at KIMSHEALTH, and today we're going to talk about small bowel transplant. Small bowel transplant is a major undertaking, and it is indicated in, broadly speaking, in the patients who have an intestinal failure, which can be because of physiological reasons or pathological reasons, where they have a short gut syndrome because of various operations done previously, or they have a tumor which needs removal of a major portion of the intestine. This group of patients unfortunately do not have enough intestine for them to carry on with the life, so they require an assessment, they require a resuscitation, and they require a nutrition. The nutrition can be provided by a parenteral route or by enteral route, depending upon the status of the intestine. In the Western world, these patients are generally managed by what we call a home TPN. So they are provided a nutrition which goes through the veins into the body, and these patients carry on till they develop the complications related to the TPN, and then they are subjected to intestinal transplant or a multivisceral transplant. Unfortunately, in India, we don't have a tailored home-based TPN available, and these patients are taken for an intestinal or a multivisceral transplant directly. There are hardly few centers in India who are doing intestinal transplant or who have attempted intestinal transplant. Unfortunately, it has a very complex pathology and immunological considerations, technical challenges, and they need to be done in a unit who have appropriate training and the facility to carry out these procedures. These patients can benefit from, there are a group of patients who can benefit from intestinal transplant if appropriately managed before and after the transplant. Again, if we look at the numbers of intestinal transplant performed, say for example in UK, they do around 20 small bowel transplants a year, and if we keep that number as a standard to compare, then India should be doing around 400-500 small bowel transplants alone a year. And it's very regretful to say that we still don't have an active transplant center doing transplants in double digits in India at the moment, but there has been an attempt by few surgeons in different parts of the country to kickstart this program, and we hope that it will become a routine after some time.